Your Community Health is a community health organisation that's been working in the Darebin area for over 50 years. Now we provide a range of health and wellbeing services for the local community, and we've got about 300 staff working here. As a healthcare organisation, we see climate change as the greatest global threat to health, and we see ourselves as having a role in minimising any harm that we have. We first formed a climate action working group in 2019 that has broad representation of staff across the organisation and our programs. And then in 2022, we shifted and we developed an actual formal action plan, which we publish and have available on our website. And that has shifted our focus to have sort of 3 focus areas within it. One is continuing to try and become a sustainable healthcare provider ourselves. The other is adapting our services to be able to respond to the health impacts that are going to be presenting in our clients as a result of climate change. And then the third one is educating clients and community about the health impacts of climate change and advocating for policies and further action on climate change. The cultural change has sort of been a gradual build-up. It started in 2019 when we first formed the working group, and it was really about staff understanding why we're doing this and why this is important, and that has sort of built the passion across the organisation for this. And then in formalising our action plan, it's sort of created a bit more sort of traction in the work across the organisation. The thought process is now not should we do this, but is there a good enough reason not to do this? For our climate action plan, we did a baseline year measure of our carbon emissions and then set targets. So we have a 60% reduction by 2030 and a net zero no later than 2040. We have a goal here of transitioning to 100% renewable, and that sort of started with solar panels. We're about to install our first solar battery at our East Reservoir site. At our Northcote site, we're implementing some heat pumps which will allow us to disconnect from gas at that site, and we've transitioned 100% of our motor vehicle fleet to electric vehicles, including an electric bus on our fleet as well. We have a procurement policy here that we've updated to have a strong focus on social procurement, including environmental sustainability, supporting First Nations business. When we're evaluating our suppliers, we look for a real values alignment. So we have made some changes to our suppliers over recent years, moving to ones that have more environmental practices. They are aware of our passion and commitment for climate change, and often we may become aware of a particular product that we want to be able to stock, and we sort of go to them, let them know about this product and encourage them to become a distributor for it. I do think that our clients and community see the work that we're doing in climate action, and it makes this a place that they want to go. We do a lot of community education pieces around climate action. Last November, we held an external event, Our Climate, Our Health, for other healthcare organisations, not-for-profits and community organisations to be able to learn why we're making these changes for climate change and how we developed our climate action plan and how they can take similar steps in their organisations. There was strong engagement and questions on the day, and there's been a lot of follow-up and contact afterwards about people wanting to learn more. My biggest tip would be just to take the step to start on the journey. Don't think that you have to be doing these massive things to begin with, but sometimes it's just starting off with the small incremental changes that you can make, and it all adds up and it all adds value, and you can build from there.